I'm Dr. Kristen Sato, one of the primary care doctors here at Student Health, and today we are going to be doing the counseling video for the subdermal implantable contraceptive devices, otherwise known as the implant or Nexplanon. So the implantable subdermal contraceptive devices are over 99% effective as a form of birth control, and they're also known as LARC, L-A-R-C, which is the long-acting reversible contraceptives family, along with the IUDs. They are more effective than condoms, withdrawal, and other forms of hormonal contraceptives just because they are not dependent on you, the patient, to have to come into the office for a shot or to take a pill every single day. The implant is inserted just under the skin of the upper inner arm, and it's about the size of a matchstick. It is not green like on this model, but it's white, and you cannot see it, but you can feel it just under the skin in the arm. It contains a hormone called progesterone, a synthetic form of progesterone, which is similar to the type of hormone that's in Depo-Provera and the Skyla and Mirena IUDs. It works by slowly releasing that hormone over a 3-year time period to prevent ovulation. The most common side effects associated with the implant are irregular bleeding. So you can have anywhere from no bleeding whatsoever for 3 years or irregular spotting. And your spotting is typically lighter than a light period. Typically using like a panty liner is fine, or maybe a light tampon, but not really having to change it so many times during the day. And your spotting may last for up to 3 to 6 months and could be every single day. So it's a pretty large range of irregular bleeding, from no bleeding at all to spotting every single day for 3 to 6 months. If you bleed and are actually bleeding requiring a tampon or a Diva cup or a pad, and you're changing it several times a day for greater than 2 weeks, at that point I would recommend contacting your provider. There is a small risk of pregnancy anytime you are sexually active with a male partner, and so the irregular bleeding may mean that you don't know when you're pregnant or if you're pregnant, and so if you experience anything with like breast tenderness or nausea or anything out of the norm, then I would recommend taking a pregnancy test at home and or coming in to see your provider as well. Along the same lines, there is a small chance of ectopic pregnancy, which means that you could get pregnant somewhere outside of the uterus, most commonly in the fallopian tubes. Those pregnancies are not consistent with normal pregnancies and cannot be carried to full term. And so if you're having pelvic pain and a positive pregnancy test, remember, anytime you have a positive pregnancy test, you need to see your doctor. Other small percentage of patients do experience other side effects, including from the implant, including nausea, headaches, moodiness, breast tenderness, acne, weight gain. Those are typically in the first week of having the implant in, as the levels come up, and then they kind of go down and plateau into a lower level in your body. The weight gain is typically not as much as the Depo shot, which can cause 5 to 10 pounds of weight gain over several years. It's usually less than that. Most of the time those symptoms resolve. If they do not, then you need to see your contact your provider right away. There is a small risk of migration of the implant. That's very uncommon. If anything, it may migrate just maybe a couple of millimeters. It shouldn't go anywhere further than that. And again, you should be able to feel the implant right underneath the skin, so you would be able to tell if it did migrate anywhere. And there's also a possibility that the implant could break. I think that would take a terribly large force to be able to do that, but obviously if you are concerned about that, you should see your provider right away. And then with regards to the procedure, there's always a possibility of infection. It is a sterile procedure, but there is always that chance that anytime we break the skin that you could develop a skin infection. There could be bruising, There will be some amount of discomfort in the area that we do the implant insertion, but that typically goes away after a couple of days. And there will be a very small scar, about 1 to 2 millimeters in size, that will be there from the insertion. How to prepare. So it's very important that you've been using consistent contraception if you've been having vaginal intercourse with a male partner. For the 2 weeks prior to the insertion, we will do a pregnancy test at the time of your appointment, and we just want to make sure that you are not in the process of getting pregnant at the time when we do your insertion. So protected intercourse includes either abstinence, which is obviously no intercourse, condoms every single time during the entire time you're having intercourse, or some other form of hormonal contraception that's been used consistently and correctly. You may bring someone along with you to the appointment, and they can either come in the room or stay in the lobby. You will be able to drive or bike home afterwards, so you don't need to worry about having an escort if you don't want one. So for the actual insertion, your provider will go over the consent with you and answer any additional questions that you may have prior to doing the insertion. You will lay down on the exam table with your arm up like so, like you're stopping traffic. And we mark the area where we'll place the implant, which is right around in here, and then clean the area off well, and use a little bit of lidocaine with epinephrine, which is our numbing medication, and then clean the area again with an iodine-based solution. Make sure that you're nice and numb, and then the actual insertion takes about 2 seconds to do, and so it's super quick and easy, and we use a device with a large bore needle that places the device into the arm. We then place a small bandage over the insertion area, and that bandage will stay on for 5 to 7 days or until it gets crusty and falls off. And throughout that time, we just recommend that you don't submerge your arm in water, so no swimming or sitting in hot tubs or the bathtub. And then we'll place a larger bandage around it, which is a pressure bandage, and that you'll keep on for 24 hours, and it just helps with the bruising. After the insertion, your provider will go over infection precautions again with you, but otherwise there is no follow-up appointment needed, which is really nice. If you have any additional questions, you can always healthy message your provider or call the advice nurse line. That number is 530-752-2349. We also recommend that you use backup birth control for the first week after having your implant inserted, just to make sure that the medication gets into your system and starts working. So some frequently asked questions. You can be anywhere in your menstrual cycle in order to place the implant. You do not need to be on your period or off of your period. It doesn't matter either way to us. You are not protected against sexually transmitted infections with the implant, so in order to prevent those, we always recommend using condoms every single time when you're having intercourse, and get tested annually or anytime you change partner. Implants do not affect your fertility at all, so you can get them removed and your fertility will return back to what it would have been at the same time as if you did not have it in. And typically, people resume their menses within like 1 to 3 months after getting the implant removed if they haven't had a normal menstrual period during the time that they've had the implant in. We will not make an incision to place your implant, and that's why your scar is so small when you get it placed, so it's only about 1 to 2 millimeters in diameter. When we remove the implant, we do make a small incision, and that may or may not be right over that scar. It typically is like 5 millimeters or so away from the insertion scar, and then that will leave a small scar as well.